Our next speaker will be Lizette Melis, and she will be, and Teresa Bertsch, sorry about that. Their talk is entitled Moms and Babies First, a mental health perinatal program at the Guidance Center.
Thank you everyone for this opportunity to present on our perinatal mental health program at the Guidance Center in Flagstaff, Arizona. We're so excited to be able to share with you all the different things that we've learned as we've developed this program over time. As all you know, Flagstaff's up in the northern part of the state, and it's in an area that is fairly rural. And our program has been developed in a way to be able to structure more what we are doing so that we can help moms in a very intentional way. Back in the pandemic, we had 2 women who came onto our inpatient psychiatric unit who were pregnant, COVID positive, psychotic, unhoused, and on involuntary treatment. And it really challenged our clinicians with what were the best ways that we could treat these moms. And at that time, I'd been participating in the ADHS, Maternal Mental Health Task Force Advisory, and also in the Access Group related to the Senate Bill 1040. And I had been aware also of the medical policies for maternal and child health and knew that there were many different areas that we could improve upon in our organizational strategies for how to take care of these moms. So this is how we developed our specific program and the guidelines. I became a clinical champion since I was the chief medical officer at the time and overseeing the care of all these moms. I developed guidelines based on evidence-based research and also those 2 reports that were done for Access and the state. We received ADHS PSI funding in order to train our staff in order to be more competent. We started collecting data and outcomes, developed an agency-wide strategic plan so that everybody was focused on the different aspects of the plan that were important for overall care. And I think a big one was that we named it, called it Moms and Babies First, in order to demonstrate the priority with it, which we were treating the moms. We applied for grant funding and received it. We were able to hire a program director and dedicated clinical staff so that we could promote the program both in the community and internally. And we continue to update the program elements.
March of 2023, I started as the program coordinator for the program. This is our current flyer. And just wanted to go through a few of the key points of our program, and I'll let you read that. But I wanted to tell you the story of Chris. She's one of our moms. She's an older mom with a history of multiple substance use disorders, alcohol and opioid use. She came to the perinatal program when she was about 3 months pregnant and already taking Subutex to manage her cravings. We arranged for the Hashabai nursery to be in touch with her, and we had the pleasure of having the nurse that is residing right now in Flagstaff to meet with her during our weekly peer support group. She delivered at the hospital in Flagstaff and was transported to the Hashabai nursery, where she stayed for only 5 days. The baby was born with no problems and no neonatal abstinence syndrome. She now wants to become a peer support, and she's doing amazing. Our second mom I want to tell you about is Adriana. She's a first-time mom, and she came to every support group every week. And at the beginning, she wouldn't speak at all. She watched attentively and took everything in. She actually had the opportunity to hold a baby for the first time in her life during group. And this is her working on a lullaby with the Lullaby Project. And she completed this in February. We want to share with you her beautiful creation. And the translation is right to the left.
Preciosa, hermosa bebé, todo mi corazón es tuyo. Mi pequeña bendición, conmigo estás a salvo. Olivia, princesa, mamá, siempre te ama. Como las aves del cielo, cantar y bailar libremente. Pase lo que pase, siempre estar a tu lado. Olivia, princesa, mamá, siempre te ama.
There's a little more, but we are very short on time. This is our current demographics. Our first year, we had 24 moms, 20 babies, and you can read for yourselves where the referrals came from and how we work in the community. Our third example I want to get through is Heather. She's 22. She has 2 children under 3 and now pregnant with twins. Unfortunately, one of them will likely not survive due to a neurological disorder. This kind of mom challenges all her clinicians due to the complexity of her pregnancy, psychiatric disorders, and also her ability to understand and integrate information. She has a low health literacy and has a difficult time understanding and applying developmental stages for her young children. Her success is that she keeps showing up every week to groups. She drives from Williams to Flagstaff about 45 minutes, and she makes it, we meet her where she is.
So thank you everybody for the opportunity to tell you about our program.